Yeah.
Okay.
Go ahead.
Let's start with this so we know what it's for. I can go like this. Okay. Ready? Hey, I'm Dr. McAdoo, and this is a quick video with narration of how to take care of your post-operative fat transfer procedure. It could be to your breast, your buttocks, your hips, face, genitals, doesn't matter. It's all the same thing. The fat is going to go from a fat pad in your body and go back into a fat pad in your body, so it's super safe. In the past, we used to inject in the muscle. That is not condoned anymore. We use an ultrasound machine to put it into your body so you know where the tube is going and it's not going to go in your muscle. So it's super safe now more than ever before because we use ultrasound in every gluteal and hip fat transfer procedure. And we don't really do a BBL per se anymore. We call it a BBL, but we're actually moving fat into the subcutaneous space above the butt and hips. BBL means we used to inject the muscle. So what really it's called is autologous fat transfer to the subcutaneous plane of the hip and buttock region. Who wants to say all those words? So we just say BBL. Okay. We also do for the breast. So I put fat under the skin of the breast, not in the breast gland, not in the muscle of the breast, not under the muscle, just under the skin, so that I can get vasodilator cream to the fat we transfer so you don't shrink. So in the past, fat transfer to the breast was not that great result because that all went away. But now we use vasodilator cream, which we'll talk about in a different video of how to use it, to keep the blood supply 5 times more efficient to the fat transferred to the breast and keep it alive. Okay, so let's talk about how I measure people for fat transfer. So everything in the galaxy was spoken into existence at one time, went from nothing to order, and the creator made everything in a Fibonacci sequence or golden ratio, which is a swirly. It's a simple way to say it. So the seashells, seed pods, galaxies, hurricanes, weather pattern, water going down the drain, goes in a circular formation. Why does it do that? So everything in the universe responds to a frequency or a magnetic field, and it lines up. So that's why the swirly shape comes from atoms and all the things responding to the magnetic field. Okay, that's a big concept. So that makes a north and south pole on the earth and in us. So the MRI machine reads a magnetic field of each cell in our body and makes a picture on the computer screen when we go to the hospital. The EKG machine beating of the beating heart shows the squiggly line on the paper because the magnetic field is changing as the heart beats, and it records it. Okay, now we got that in our note. I use those measurements of the Fibonacci sequence, the swirly, and adapt them to all the parts of your body. They do this for the facial reconstruction, rhinoplasty, and you can use it for every part of the body because all of our extremities, turbinates, nose, ears, eyes, eyebrows, arms, and legs are forming away from the spinal cord and following that spiral shape away from the body. So now we can quantify what you should look like by measuring your skeleton, your bones, your hands, your sacral bone, your hip bones, to figure out what the fat should look like on your hips, butt, breast, face, everywhere. Different video for how that's measured. Back to post-op instructions. So we've done the fat transfer in that particular way, and any place we put fat in the body, we do not want compression or vasoconstriction, which will both cause less oxygen delivered to your fat grafts. So outside pressure from the garment, pressure from sleeping on the bed, from sitting on the chair, from being in the hookah lounge, from drinking your Starbucks coffee, from being around friends running the vape you can't smell, will cause your fat to reabsorb. So you gotta stay away from all that stuff. So no pressure on the butt when you're sitting in the chair, no pressure on your butt when you're sleeping, so you have to use some kind of lounger with the hole so your butt hangs through it, and we can talk about that in a different video. And then in the airplane, in the car, you probably should have a bolster behind your back, the small of your back and underneath your hips, so underneath your thighs, so that your butt cheeks don't touch the chair. You might have to ask for the seatbelt extender on the airplane. So, you're not 4 inches above your airplane seat, you might not be able to close the belt, so you have to get the seatbelt extender from the stewardess. And by the way, that if you get a chair made, you can go back through the airport and call it a health aid device, and they'll gate check it. That's pretty much it. The rest of the drain care and the lipo part will be covered in a different video. And that's it for post-op instructions for fat grafting.